Hello friends, hi. Welcome to my channel, The Voice of Nurse. Today we discuss about the January NHM 2023 staff nurse solved questions and answers. This is part 3 friends. Actually in previous video I already did part 1 and part 2 also. You can check in previous video and we are discussing about the continuation question 60 to 40. This is part 3. Before move on to topic, small request friends, please like a video and please give a comment and share the video and please subscribe my channel. Click on the bell icon for further notifications. Move on to topic, question number 61. The true labor pain is characterized by option A, lower abdominal pain associated with vaginal discharge. Option B, pain from lower abdomen. Option C, lower abdomen pain associated with uterine contractions. And option D, all of the above. What is true labor? Actually, in this case, true labor cases, patient is having a strong and regular contractions. Here, option A, B, C, D means option A, B, C is the correct answer because the patient is having lower abdominal pain associated with vaginal discharge and also pain from lower abdomen, and lower abdomen pain is associated with uterine contractions. In these cases, patient is having lower abdominal pain and vaginal discharge and also the uterine contractions. So option is D is the correct answer. Next move on to question number 62. Treatment of choice in a patient of depression with suicidal tendency. Option A, electroconvulsive therapy means ECT. Option B, MAO inhibitors. Option C, tricyclic antidepressant. Option D, fluoxetine. Here option A is the correct answer, electroconvulsive therapy. Why? In these cases, ECT improvements in the people who have severe symptoms of depression and mania. Electroconvulsive therapy can provide rapid and significant improvements in patients. This is the one of the treatment of choice for depression to determine or to detect the suicidal tendency cases or psychological problemic conditions. We can detect through the electroconvulsive therapy. In option B, C, D, these are the medical management. Actually here the treatment of choice is ECT. Answer A. Option A, ECT. Next move on to question number 63. What is the junction of small intestine and large intestine is called as? Option A, duodenum. Option B, jejunum. Option C, caesium. Option D, ileum. The caesium is a largest tube like a structure in lower abdominal cavity. It receives the undigested food material from the small intestine. Means answer here option C is the correct answer, caesium. The small intestine constituted by the duodenum, jejunum and ileum. Here mentioned in between the junction means the small intestine, large intestine, between the location junction is called as caesium. Option C is the correct answer. Move on to question number 64. Mini mental scale is what? Option A, method to investigate the common psychiatric problems. Option B, 30 questions for cognitive function. Option C, to evaluate the schizophrenia. Option D, instrument to measure the delirium. Actually mini mental scale MMSE means, actually here mentioned mini mental scale. MMSE, mini mental scale examination to use check the cognitive impairment of the person. In here option is B, 30 question for cognitive function. This is the one of the type of assessment in the psychiatric patients conducted by through the medical professionals, used to check for cognitive impairment problems like a patient is having thinking problems, communication problems or memory problems. Option B is the correct answer. To question number 65. What is the place of production of RBC in adults? Option A, liver. Option B, heart. Option C, blood. Option D, bone marrow. What is RBC? RBC stands for red blood cells. In healthy adults, the man has on average 5 million to 5.5 million RBC in blood. Actually, the production of RBC done by in bone marrow. Option D is the correct answer. Here option D is the correct answer. On to question number 66. Peg cells are seen in option A vagina, option B vulva, option C ovary and option D tubes. Actually, peg cells is having in uterine tubes. Uterine tubes. These uterine tubes is having peg cells in females. In females only it is present in uterine tubes. These are the non-ciliated epithelial cells. Actually, the peg cell function is making the fertilizing an ovum into the ampulla. Option D is the correct answer. Move on to question number 67. The nursing interventions to prevent the respiratory complications includes option A monitoring vital signs, option B deep breathing, option C turning in bed every 2 hours and also maintain the hydration. Option D all of the above. Patient is having respiratory complications means as a nurse we have to check vital signs, means monitoring the vital signs and observe the patient's breathing pattern. Next, we have to turn the patient every second hourly because of the respiration problem, means they will be having some of the issues taking breathing, and also we have to maintain hydration of the patient. Here option D is the correct answer, means monitoring vital signs, deep breathing observing and turning the bed every second hourly. We have to maintain the hydration of the patient. Next, move on to 68 question. Iodine is required for synthesis of hormone. Option A protein, option B fat, option C CHO means carbohydrates, option D thyroxine. Actually thyroxine also called as T4. Thyroxine is a main hormone secreted into the bloodstream by the thyroid gland. Iodine is required for thyroxine. Option D is the correct answer. Question number 69. Bone deformities occur due to the excessive intake of what? Option A phosphorus, option B potassium, option C fatty acids and option D fluorine. Bone deformities means this is the one of the disorder of skeleton system. Fluorine is a most reactive related to chemical element highly toxicity, having chemical element and highly toxicity. For example, the condition skeletal fluorosis is a serious condition of bone deformities, and also one of the example for the bone deformities fluorine osteosclerosis. Option D is the correct answer, fluorine. Move on to question number 70. What is the primary common cause of the MMR? Maternal morbidity rate. MMR means maternal morbidity rate. Option A infection, option B brain damage, option C hemorrhage, option D is the preeclampsia. Actually in MMR, maternal morbidity cases, the major complication that occurred for nearly 2/3 of all cases is the bleeding, means hemorrhage is the correct answer. Option C. The secondary cause of MMR is infection. Option A. Third cause is preeclampsia. Here asked about primary common cause, means option C hemorrhage is the correct answer. Next question number 71. Wermer's syndrome is considered as option A MEN1, option B MEN4, option C MEN2, option D MEN3. Actually I have to clarify what is MEN. MEN is a multiple endocrine neoplasia, means the disorder occurs in endocrine system. Here neoplasia means uncontrolled abnormal growth of the cells in the body or tissues. MEN means multiple endocrine neoplasia. Wermer syndrome. Actually this is occurred in related to the endocrine system. Option 1 is the correct answer. Wermer syndrome is rare autosomal dominant inherited disorder. Actually, in these cases, effects will be happening in endocrine system. Just now I already discussed. It leads to tumors in the parathyroid and pituitary glands. Means enter in this disease, endocrine system will be involved. Option A is the correct answer. Multiple endocrine neoplasia 1. Answer A. Move on to question number 72. Full form of IUGR. Option A, intrauterine growth restriction. Option B, intrauterine growth retardation. Option C, intrauterine growth retention. Option D, intraurethral growth retention. Actually, IUGR is related to fetal growth, means also called as fetal growth restriction. Option A is the correct answer, intrauterine growth restriction, due to the low oxygen levels in the womb and also high level distress during the labor and delivery. Infections also one of the causes. These are the one of the causes for the IUGR. Means option A is the correct answer, intrauterine growth restriction, and also called as fetal growth restriction also. Option G. Next we will move to question number 73. Total weight gain during pregnancy is approximately. Option A 11 to 16 kgs. Option B 8 to 10 kgs. Option C 20 to 25 kgs. Option D 6 to 8 kgs. The weight gain during pregnancy in first trimester, it will be approximately 1 to 2 kgs. Then 1 kg for 1 week for the rest of the pregnancy. Means first trimester 1 to 3 months of the pregnancy period, it will be 1 to 2 kgs. Then 1 kg for 1 week, approximately up to 9 months. Between the 25 to 35 pounds, means most will be common 11 to 16 kgs. In the overall period of 9 months of pregnancy, they will be increased. Option A 11 to 16 is the correct answer. Next move on to question number 74. The third stage of labor is option A dilatation of cervix. Option B full dilatation of cervix to expulsion of fetus. Option C after expulsion of fetus, and option D B and C. Here option C is the correct answer, after expulsion of the fetus. Actually, in this question, here options we can observe. Stage 1 is dilatation of cervix. Stage 2 is option B full dilatation of cervix to expulsion of the fetus. The option C is the third stage, means here after expulsion of fetus and expulsion of the placenta. Actually here after expulsion of fetus and expulsion of the placenta also will become option C. Option D, B and C. Answer is option C, after expulsion of fetus and to expulsion of the placenta. And also stage 4 will be there in labor, that is the observation. Option C is the correct answer, after expulsion of fetus to expulsion of placenta. Question number 75. Family planning method with low failure rate. Means which of these following low failure rate in family planning method? Option A chemical method. Option B tubal ligation. Option C natural method. Option D IUD. Actually, low failure rate will be in the permanent method. We have to see here what is the permanent methods. The option B is the permanent method, tubal ligation. Tubal ligation is a surgical procedure for female sterilization in which the fallopian tube are permanently blocked or permanently clipped. Otherwise, it will be removed. Option B is the correct answer, tubal ligation. Left all the options are normal methods, means non-surgical methods. Option B is the correct answer, tubal ligation is having low failure rate of family planning. Next move on to question number 76. Japanese encephalitis is caused by. Japanese encephalitis caused by option A flavivirus, option B Lissa virus, option C Brucella group of virus, option D spirochetes. Actually, Japanese encephalitis is a virus spread by the bite of infected mosquito to the one person to another person. The bite of mosquito will be having the virus infection, already infected mosquito will be there. Option A is the correct answer, flavivirus. The symptoms will be headache, high fever, disorientation will be there in these cases. Convulsions and coma will also one of the symptoms. And Japanese encephalitis is the most common in rural and agriculture areas. Option A is the correct answer, flavivirus. Question number 77. The duration of 12th 5-year plan was option A 2007 2012, means 2007 to 2012. Option B 2009 to 2014. Option C 2012 to 2017. Option D 2014 to 2018. Actually, what is 5 years plan? Actually, 5 years plan will be conducted by in the Indian government. It will be 5 years plan. Last 5 years plan in these options is 2012 to 2017 was in India is conducted the last 5 years plan. After that, ministry is formed. Option C is the correct answer, 12 to 2017. This is the last duration of 5 years plan. Actually, 5 years plan started it in 1947. It stopped, means last 5 years plan in the last year is 2017. Option C is the correct answer, 2012 to 2017. Next, move on to question number 78. Mode of transmission of hookworm infection by option A nasopharyngeal route, option B hematogenous route, option C fecal-oral route, option D none of the above. What is hookworm disease? Hookworm disease is a infection while food and water, through the food and water. This is the cause type of infection known as helminthiasis, means one of the condition in hookworm disease. Helminthiasis is the one of the type of hookworm disease. Option D is the correct answer, none of the above. Here there is no infectious, means mode of transmission is actually hookworm will be in while through the food and water. Here nasopharyngeal and hematogenous and fecal-oral route, and there is option is none of the above. Here there is no answer. Hookworm infection will be occurred through the water and food. Question number 79. First dose of measles vaccine is given at the age of, at which age the baby will receive first dose of measles? Option A 6 weeks old baby, option B 5th month, means 5 months old baby, option C 9 months old baby, option D 24 months baby. Actually, in this we are having measles doses. Actually, we are having should get 2 doses MMR vaccines. In this measles will be start at 9 months first dose, and next we have to receive 4 to 6 years of age. Option C is the correct answer. We have to receive the first dose of measles is the 9 months. Answer C. Move on to question number 80. Which vaccine is the live attended vaccine? Option A BCG, option B oral polio vaccine, option C measles, option D all of the above. Option D is the correct answer. These all are the live attend vaccines. For BCG for the tuberculosis, oral polio vaccine for the polio eradication, option C measles is a communicable diseases for. Option D is the correct answer, all of the above. Option A, B, C, these all are the live attended vaccines. Question number 80. Which vaccine is to be stored in freezer compartment? Option A DPT, option B BCG, option C hepatitis B, option D TT, means tetanus toxoid. In freezer compartment we have to store option B BCG vaccine. It will be give at birth or for the within 28 days of old baby also will get BCG vaccine for the tuberculosis. Option B is the correct answer, BCG. Question number 82. When you will discard the vaccine by monitoring VVM? VVM means vaccine while monitoring. As a nurse, when you will discard the vaccine? Well, observing the option A, color of inner square is lighter than outer circle. Option B, color of inner square is darker than outer circle. Option C, color of inner matches with outer circle. Option D, B and C. Here option A is the correct answer. We have to observe the color of the inner square, medicine color, and also observe the light circle of the means expiry date. With before we have to discard the medicine before the 28 days. We don't want to use, actually if we are using that medicines means patient will get side effects. Option A is the correct answer. Color of inner square in lighter than outer circle. Next move on to question number 83. What is AEFI? AEFI means option A, adverse events following infection. Option B, adverse events following immunization. Option C, adverse effects following infection. Option D, adverse effects following immobilization. Actually, option B is the correct answer, adverse events following the immunization. In this AEFI, related to the cases, vaccine products or immunization related to the reactions, and also immunization related to anxiety and related to the reactions, means the person will having immunization related issues. Option B is the correct answer, adverse events following immunization. Number 84. Which are the communicable diseases as following? Option A, smallpox, mumps, cholera, filariasis. Option B, tuberculosis, malaria, chickenpox and influenza. Option C, diabetes, rheumatic artery diseases, cancer, hypertension. Option D, both A and B. Actually here diabetes, rheumatic heart disease, cancer, hypertension, these all are the non-communicable diseases. Smallpox, mumps, cholera and filariasis, tuberculosis, malaria and chickenpox, influenza, these all are the communicable diseases. Communicable diseases means we are receiving illness that spread from the person to person, otherwise animal to person. From the foods also we are receiving communicable diseases. In these diseases all can be transmitted during the air travel, means droplets, direct contacts also. This is the communicable disease. Option A and B is the correct answer. Question number 85. Oral polio vaccine was developed by? Option A, Dr. Francis Collins. Option B, John M. Last. Option C, Dr. Albert Sabin. Option D, Sander. Actually, the Albert Bruce Sabin, man who made OPV vaccine, and secondly, that will be done by Dr. Albert Sabin. Means the Albert Bruce Sabin is the first made 1906 to 1993, actually in this period. He made a oral polio vaccine. The second type of oral polio vaccine is Dr. Albert Sabin. For developing the, he is a microbiologist, he developed oral polio vaccine. Option C is the correct answer, Albert Sabin. On to question number 86. The population covered by PHC in plain area. Option A, 6,000. Option B, 30,000. Option C, 10,000. Option D, 1 lakh. Actually, in general areas, 1 per 20,000 population in tribal areas and hill areas. Actually, in generally, 1 per 20,000 population in tribal and hill areas. In PSC, the option B is the correct answer, 30,000 population covered by PHC. Option B. Move on to question number 87. The formula for calculation of intelligence quotient. Option A, intelligence quotient IQ equal to chronological age by mental age into 100. Option B, IQ equal to chronological age by mental age into 1000. Option C, IQ equal to mental age by chronological age into 1000. Option D, intellectual quotient IQ mental age by chronological age into 100. Option D is the correct answer, mental age divided by chronological age into 100. This number will be representing a person's responding and also reasoning abilities of the person. IQ levels will be monitoring. Option D is the correct answer. On to question number 88. WHO stands for, this is the easy question. Option A, World Health Organization. Option B, World Health Office. Option C, World Health Organism. Option D, World Health Occurrence. Option A is the correct answer. All of you know about World Health Organization. World Health Organization is working to promote the health, keep the world safe, and to serve the vulnerable peoples. For WHO main aim. WHO means World Health Organization. Option A. Question number 89. Which of the following one is correct? Here option A, National Rural Health Mission is known as NRHM. Option B, Integrated Mission of Neonatal and Childhood Illness known as IMNCI. Option C, United Nations International Community Emergency Fluid is known as UNICEF. Option D, Integrated Disease Screening Project is known as IDSP. Here options are, actually we have to observe the options, abbreviations. We have to know abbreviation. Previously in this previous question also mentioned some of the observations. Option A, National Rural Health Mission is the correct answer, NRHM, because in this IMNCI here they mentioned Integrated Mission of Neonatal, actually Integrated Management. This is the wrong. So next option C, UNICEF, United Nations International Community, actually United Nations Children Emergency Fund. UNICEF means United Nations Children's Emergency Fund. This is also wrong. Option A is the correct answer. NRHM, National Rural Health Mission is known as NRHM. Let's move on to question number 90. BCG vaccination means BCG vaccine is contraindicated for. Option A, pregnant women. Option B, symptomatic HIV infected patients. Option C, immunocompromised patients. Option D, all of the above. Actually, in BCG vaccine is contraindicated for pregnant women and those who are having symptomatic means HIV infection, and immunocompromised patients also contraindicated for the BCG vaccine. Option D is the correct answer. These all are the contraindicated for the receiving BCG vaccine. Next move on to question number 91. Components of epodemological Traid. Option A, environment, agent, population. Option B, environment, agent, host. Option C, society, environment, population. Option D, disease, host, man. The option B is the correct answer. No need of explanation regarding this question. Actually we are having in triangular shape. We will imagine environment, host and agent. Option B is the correct answer. Next move on to question number 92. World Health Day is celebrated on. Option A, 5th June. Option B, 7th April. Option C, 1st of December. Option D, 8th of May. Actually we are celebrating the World Health Day 7th April. The aim of World Health Day to be create the awareness of specific health theme to priority areas, means make a awareness regarding the health conditions, health themes. Option B is the correct answer, 7th April. Question number 93. Full form of ECT. In previous question, this is the one of the option ECT. Here question was full form of ECT. Option A, emergency control therapy. Option B, electrocontrol therapy. Option C, electroconvulsive therapy. Option D, electroradiotopography. ECT means electroconvulsive therapy when the antipsychotic drugs not working on a patient, like a schizophrenia cases. In these cases, the person can be treated with ECT, means schizophrenia cases. For example, schizophrenia, the psychotic drugs will not work on the patient, the ECT will be done. Question number 94. Repetition of words spoken by others is called is. Option A, echophalia. Option B, echolalia. Option C, echopyrexia. Option D, none of the above. Actually in this question is their answer. Repetition means the person is having psychiatric problem, and also some of the child will be repeated the words. After hearing the words they will repeat automatically. Option is the B. Echolalia is the correct answer. Echolalia means the child is repeating the word they hearing in automatically. Today they will hear, after 1 day or 2 days they will repeat the word. Echolalia means repeating the words. Option B is the correct answer. Echolalia. Next move on to question number 95. Clostrophobia is fear of what? Option A, open places. Option B, closed places. Option C, dark places. Option D, overcrowding. Actually, claustrophobia is fear of enclosed places. Also, closed means the closed places. If a person, claustrophobia person is seeing the closed places, the person will automatically show the anxiety related to anxiety. This one also anxiety disorder that mainly cause the intention of the fear. Exclosed places. Answer B is the correct answer. Closed place. Question number 96. Hormone secreted by the kidney. Option A, melatonin. Option B, insulin. Option C, erythropoietin. Option D, calcitonin. For the answer options, we have to know which gland is secreted which hormone. Okay friends. Option A, melatonin is secreted the pineal gland. Option B, insulin secreted by the pancreas. Option D, calcitonin secreted by the thyroid gland. Here option C, erythropoietin is secreted by the kidney. Option C is the correct answer. Question number 97. Plague transmitted by option A, water. Option B, insects. Option C, animals. Option D, food. Water, insects, animals, food. Option C is the correct answer. Plague is an infectious disease that affects from the animals and humans. Means through the animals we are getting the plague. The caused by the organism bacterium is Yersinia pestis. The Yersinia pestis is the organism, means the through the Yersinia pestis infection we are getting through the animals. Option C is the answer, animals. Question number 98. Increased plasma volume leads to option A, hemodilution. Option B, semi-dilution, means semi-hemodilution. Option C, dilution, and option D is the absorption. Actually answer is A, hemodilution. What is hemodilution? Hemodilution will be occurred, means one of the cause for hemodilution is administration of large amount of IV fluids. This is the one of the type of removing RBC to decrease the plasma volume into down, means hemocrit. Option A is the correct answer. Hemodilution is the correct answer. Question number 99. The gauge of needle used in intradermal injection. Option A, 12 gauge. Option B, 20 to 26 gauge. Option C, 24 gauge. Option D, none of the above. Actually, what is intradermal injection position? Intradermal injection position will be administered into the dermis and just below the epidermis. Option B, 20 to 26 gauge is the correct answer. Option B. Move on to last question. Question number 100. When a person blames others for his own weakness, he is using the mechanism. Which mechanism he is using? Option A, sublimation. Option B, rationalization. Option C, suppression. Option D, projection. Actually in these cases person can be defense himself, means it is the one of the defense mechanism. The person can defend himself with logical reasons and explanation. Option B is the correct answer. Rationalization is the correct answer. Option B. These are the 100 questions in NHM 2023 this month January question paper. Thank you for watching friends. Please friends, one click, one like. Please subscribe my channel. Please give a like and click on the bell icon and subscribe my channel. Thank you friends. Thank you so much.